Welcome, everybody. I am Dr. Jana Heyman, and I am the chair of the Ravazzin Center on Aging and Intergenerational Studies. And I'm always excited to host students that are interested in careers. We really feel aging has a lot to offer students, and many positions that you may take, many different careers that you may be exposed to. You never know what journey you may have in the future. So we are hopeful you will be touching the lives of older adults. And when you're often dealing with a family, whether it is with children, adults, you are very much engaged with families, being maybe the grandparents, the relatives that may be helping to support others. So we are excited that everyone is going to be joining us and hearing from us. I am going to introduce a couple of the students that are involved in this program. I'd like to introduce Lily. Lily Hammer has been involved in working with older adults in her MSW, as well as Elizabeth Wolf, who is here. So Lily is on our Lincoln Center campus, and Elizabeth is here tonight representing our Westchester campus. So we're excited to have both of you here this evening. And we have amazing speakers. And I am going to ask Lily to start off by introducing our first speaker. And then Elizabeth is going to introduce our second speaker as well.
Thank you, Jana. Hi, everyone. Thank you for coming. It's my pleasure to introduce our first speaker, Fay Kahan. Fay is a dedicated and experienced social worker who has been serving older adults at Mount Sinai Hospital for over 37 years. Fay began her career in the inpatient geriatric psychiatry unit before transitioning to the inpatient cardiothoracic and medicine units. For the past 25 years, she has been a vital part of the Martha Stewart Center for Living, Mount Sinai's outpatient geriatrics division, where she continues to support older adults in navigating the complex challenges of aging. Fay is a leader in elder abuse prevention. As Mount Sinai's elder abuse coordinator, she provides counseling and referral services to victims. She also provides education and training to hospital staff and collaborates with social workers in other areas of the hospital. Fay's expertise extends to research and advocacy, as she has co-authored 2 articles on elder abuse. She has collaborated with multidisciplinary teams across Manhattan, including agencies such as Adult Protective Services, to address these critical issues. With her wealth of knowledge and extensive experience in the field, Fay is an incredible resource for anyone interested in working with older adults. Please join me in welcoming Fay Kahan.
Thank you so much, Dr. Hyman and Lily. That was a really lovely introduction. Lily and I have met before because I'm also part of the upper interagency council in Manhattan. And we do offer a stipend to students who are interested in working in the field. And this year, Lily was the recipient. So congratulations again, Lily. I congratulated before, but congratulations. And it's a delight working with you, Dr. Heyman. Working with Fordham and having, this relationship through the Interagency Council and even having students here at Mount Sinai, although I have not had a Fordham student for a bit. But so thank you again for the introduction. When people ask me what got you interested in geriatrics, I really don't have a good answer other than to say that I never really grew up with grandparents. My paternal grandparents died in the Holocaust, and my maternal grandmother died just a couple of weeks before I was born, and my maternal grandfather passed away when I was 6 years old. So I think, it kind of serves a purpose for me. So I always wanted to be in the quote unquote helping position. In fact, when I applied for social work school, I applied to Yeshiva Wurzweiler. And I went for the interview when I was quite young at the time. And the person who was interviewing asked, why do you want to, be a social worker? So I said, well, I want to help people. So he turned to me and said, well, why don't you become a sales lady? you can help people that way too. Needless to say, I didn't get into that school, but I got into Adelphi University and pursued my career there. So my field placements at the time, also my first one was at a nursing facility. Actually, my first one was in a mental health setting, and my second one was in a nursing home. And that kind of sparked my interest, and it continued. So my very first job after school was, and it's funny because my cousin tells me all the time, just tell everybody you started working when you were 6 years old, because I think telling you all my experience shows my age. My first job was in a senior citizen center, which was nice. I'm not sure that there was all that much clinical work there. It was more like setting up programs for people, although, there was a certain amount of clinical work involved as well. My second job was in an adult day program, specifically for, elderly people. It was stationed in a nursing home, even though the people would come and go with, like I said, an adult day program. And they also had a dementia unit, for people who had dementia. So twice a week, they would come into our adult day program. Um, I then saw an ad for Mount Sinai, which at the time was very generic. It said social workers wanted at Mount Sinai. And I thought at that time, maybe they needed it for their home care division, because it wasn't too specific. I later learned that they had a couple of positions available, so they just didn't, itemize and say which particular area the positions were in. So based on my resume, they called me and they said, okay, being that you've been working with people with dementia, you would be appropriate for our geriatric psychiatry inpatient division. When I came in, I thought, no, I want med surg, but I figured, okay, let me get my foot in the door. So I got my foot in the door, and actually the geriatric psychiatry division proved to be, extremely educational. I really learned a lot, just even I hadn't really been in a medical setting, so just learned the medical terminology. I was there for 4 years. I then transitioned to cardiothoracic surgery. And again, cardiac surgery can happen at any age. They even do it on babies. But, nevertheless, in any medical surge unit, you are going to find elderly people. So, my experience there also was with a lot of older people. I then transferred to general medicine before coming to the outpatient Martha Stewart Center. So, you can ask, what do we actually do in the center? So basically, we're very fortunate that we have we have over 3,000 people, patients. The reason it's called Martha Stewart is because she gave a large donation several years ago. Excuse me. We had our own space that they had renovated specifically for us, but then when COVID struck, they needed to use that space for COVID. So now we're kind of transitional and we're just in another space for now. She also donated money to to the Beth Israel Center, which is now part of Mount Sinai. So down on 16th Street, the outpatient division there, they have a Martha Stewart Center division as well. So as I said, the doctors who work here are either attendings, which means that they've gone through their schooling, they've done the fellowship, or they're fellows. So it's people who want to go into this field. And I should say that it's the Department of Geriatrics and Palliative Care Medicine. So we're also doing palliative care, practice in the Martha Stewart Center. So as I said, the doctors want to be here. They're very attuned to both the medical and the social needs of the patients, which is really great because they can identify when the patient needs to see us. They can identify, what the patient's needs are. They can work with the family members. So it's it's a wonderful, we call them now a family here. They're like second family. Many of our patients we get to know on a regular basis because they come in so frequently. We always joke in the practice that I have this 91-year-old Pakistani gentleman who comes to see me practically every week for something else. So they refer to him as my boyfriend at this point. So, some of the things that we do with some of the concrete work, we assist with insurance, with getting transportation services, Meals on Wheels, home care. We do a lot of home care. A lot of the patients, have home care services, but they need an increase in service because there's nobody to take care of them. So we're constantly writing letters, calling the agencies to see if we can get help. But we also do some clinical work. I mean, unfortunately, with the amount of work that's here, as you can hear, as I said, there's like over 3,000 patients. It's hard to do a lot of clinical work, although there are 4 of us. So I am technically half-time for Martha Stewart and technically half-time for the elder abuse program. We have 2 work, and then we have the 3 others who are here as well. One just started, so it's a little bit of a, slow start right now. So there are 4 of us who have to divide it. So there isn't all that much time for the clinical work, but it definitely does exist. Plus the fact that we do have in the program, in the practice here, what we call our impact program. So we developed this program where we will provide short-term counseling for people with moderate depression. We can't do it with severe depression, with moderate depression or anxiety. And the way we are able to, test that is we do the PHQ-9. I'm not sure if any of you are familiar with the PHQ-9, but basically it's 10 questions, even though it says PHQ-9. It's 10 questions that rates the person's mood. And then based on the scoring, it determines whether the person is, mildly depressed, moderately depressed, or severely depressed. And there's what we call the GAD-7, which is 7 questions that we ask in terms of anxiety. And certainly you can always Google them and, see what the tests actually look like. And if somebody has moderate depression or anxiety, we are able to, meet with them for 8 sessions where we do ITP, interpersonal treatment, IPT, and to personal treatment, where we identify an area, and the 4 areas are grief, social isolation, transition, and dispute. So we identify one of them, and then we try to help them problem solve and see how we can get at the root of the problem and make them feel better. There is a medical doctor who is in charge of the program. There is a psychiatrist who consults. We have a geropsychologist who is actually retiring. And then there's myself and my colleague who do this treatment. Often we find that these people really need more than just the 8 sessions. So we either have to continue, even though we're not supposed to, but I've done that, or we have to refer them elsewhere. Finding psychiatric help or, even counseling for patients with Medicare or Medicaid is extremely, extremely difficult. I hate to sound monetary, but I don't think that the doctors get reimbursed very much. So most of them have opted not to accept the insurance. There are a couple of agencies out there who do. One of the bigger agencies in Manhattan is SPOPS, Special Programs for Older People, who provide counseling, and they do have a psychiatrist on board as well. So that's been helpful as a resource. So we also have what we call the Jerry Align program here within our practice. And those are for people who are more prone to, have repeated hospitalizations, who don't show up for their appointments. So it's a more coordinated team who kind of meets with the patients, calls them regularly to ensure more of a compliance and to help them, stay better connected to the medical team so that they're not using the emergency room, inappropriately. What I also like to talk about is caregiving. So we have a lot of patients who are coming in here with dementia. And as you can imagine, it's quite difficult for the caregivers, both in terms of, some behavioral disturbances. People with dementia might be agitated, or sundowning, where they sundown at night when it kind of afternoon going into night. They sundown and their agitation increases. And in fact, now the hospital received a grant. It's called the GUIDE program, which is apparently in many hospitals across the state, where we will be able to provide more services to caregivers of patients with dementia and get reimbursed for that. So it hasn't started yet. They're in the planning stages, but that should be an interesting thing to come, because it's definitely something that's needed. Again, we can provide resources, we can refer them to Care in Kind, which is the dementia caregiving program. They also have many programs for people with dementia, some cultural programs, Connect to Culture, I think it's called, from Care in Kind. If you go to their website, you would see it. So that's really it in a nutshell in terms of the work that I do. It could be intense at times because you're dealing with patients and family members who are quite distressed. As I also said before, we're dealing also with palliative care. So we have patients who are at the end of their life. And that can be very, stressful, obviously, for patients and families. I, was just speaking to a family member earlier today, and you could see that there is, real ambivalence. On the one hand, they've allowed home hospice to go in. On the other hand, it's like, oh, but my mom's not feeling well. I think she needs antibiotics and she needs treatment. And, and that's okay. I mean, each family member and patient has the ability to make their own decisions about what they want, but you can see the ambivalence there and, how we have to work with that. So that's basically it in a nutshell. I should say that it just so happened that when we have jobs available, it gets, sent out to the social work department. So there was a job, posted for med surge today. So it says, oh, let me look at what the salary range is so that I can tell everybody today. So it's not bad. I think it's not bad. I don't know what your expectations are, but I saw that the salary range, I guess it depends on what your level of experience is, was from $85,000 to $98,000, which I think 85 starting off is really not bad at all. So, again, I think we said that we'll hold the questions until after Ms. Fenley speaks. But I'm happy to entertain any questions or comments.
Thank you so much, Fay. That really is very interesting and very diverse. We appreciate it, and we'll save some of the questions, which I know our students are going to have some great ideas and things they would like to ask you about. And we'll introduce Elizabeth. Are you willing to introduce our next speaker?
Absolutely. So Dr. Robin Fenley is a social gerontologist whose practice areas have included caregiving, dementia, elder abuse, inpatient psychiatry, long-term care, and contract management at the community, institutional, and governmental levels. Currently vice chair for the NGO Committee on Aging of New York, which advocates for older persons through the United Nations, Dr. Fenley retired from the New York City Department for the Aging as Assistant Commissioner. She is a member of the Gerontological Society of America, the International Association of Gerontology and Geriatrics, and is on advisory boards for the intellectually and physically disabled aging population and for unhoused older adults. She has coordinated and chaired conferences, conducted workshops, and contributed to published articles and chapters throughout her career. A licensed clinical social worker, Dr. Fenley is an adjunct professor of policy at Fordham University Graduate School of Social Service and is currently teaching social work practice with older adults. Please join me in welcoming Dr. Fenley.
Yay for Fordham.
Thank you.
Yeah, thanks a lot, Elizabeth. And Dr. Heyman, thank you. Actually, I have Dr. Fenley thanks to Dr. Heyman and her assistance with research. So whatever it is that you may be struggling with or have questions, let me just tell you that the faculty at Fordham is there for you. In terms of wanting to see people succeed, that's everybody from administrative staff, from security on up, so You all have chosen a good school. You've chosen wisely in terms of schooling. But thank you. And Fay, I really appreciated hearing the things that you had to say. Personally, they were updates for me from my time actively working in the field. You know, some of the changes that are out there, different programming and that. But it's sure good to hear that we still have some really premier organizations that are out there, you know, certainly Mount Sinai being one of them. But, you know, when you talk about SPOP and Karen Kahan, these are people, you guys who are going to work in aging, you have to have that in your back pocket. I think just generally speaking, one of the things that I think that you have selected social work. I'm assuming you all are social work students. The skills that you will learn and have learned and will take with you, these are applicable across fields, across populations. And it really just starts with your fundamental, actually, frankly, I think it's compassion that brings you to this field in the first place. You know, that there is this desire that you want to alleviate the suffering or seeing the injustice that's out there. There's something that pushes you to right the wrongs. And it's that allows you, I think, to sort of eat all that you learn in the classroom, and you don't realize it, but when you're out in the field and you're doing your work with the people, all of this stuff comes back. And so I say that it crosses from your clinical work through into your if you work into administration. So my master's policy major, I went to Rutgers. I was afraid of New York City at the time, truthfully, even though I was living here. So I went to Rutgers, but it was an administration, policy, and planning major. I didn't want to do clinical, but you know what? Because there is something about being in social work that people who have issues, even if you say you want to be in admin, you still are working clinically with people. If not the clients, you are sometimes doing work with your staff. So it's cross-cutting. So anyway, I guess maybe what I can do is if you don't mind, I have let's see, PowerPoint. It's just a couple of slides. Lily, it's only a couple of slides. Lily is in one of my classes and we do slides there. So I wanted to talk to you about some of so that you could actually see the opportunities that are, and this is not all inclusive. And then I also have another slide that talks about some of the settings where you could find employment. And because it is about employment, bottom line, right? You need to get a job and you want to have a job that pays. And Faye, you are 1,000% right. To start off at 85,000, wow, that's tremendous. That is really good. I would add one job that is not here on this particular slide, is that of a private geriatric care manager. These are they've been described as everybody's daughter, you know, sort of a sexist comment, but nonetheless, thinking that the daughter is the one who does the primary caregiving at home, whether it's there for the children or for the parents. And so the geriatric care manager, you know, they can identify how much of a daughter they want to be. You know, go to the hospital in the middle of the night because your older client fell, or no, I'll help you with your Medicaid application and, you know, provide some referrals to activities during the day. So you can make your own decision. However, the key word is it is private. It's a private geriatric care manager. You can set your own fees, and it's you know, a concierge service, so to speak. That one you can make some good money on. Just file that away. So one of the things that I wanted to say is that for most social workers coming right out of school, they will get jobs as case managers. I mean, you know, we all pretty much start there. Case managers in social service agencies frequently. I will also say, and going back to the hospitals, Hospitals, if you get your job right out of social work school and hospitals, they will pay much better than the social service agencies in the community. So bear that in mind as well. But I will, and both you get this experience that you get is tremendous, right? So thinking about being as a case manager, you will learn so much. And if you have the opportunity, and this is really kind of tough, but if you are a case manager who does home visits, wow, you really will learn a lot. You will learn much about the clients. They could be on the phone. You say, hey, how are you doing? They say, oh, I'm really good. Everything is fine. I'm taking my meds and whatever. Okay, well, I'm going to come and see you tomorrow. You go and see them tomorrow and you see, you know, a kitchen table full of medication bottles that are half opened, half, consumed. You could see the person is clearly not doing well. So as the case manager, you are the eyes and ears. It is very, very informative. But invariably, because case management does not pay a lot and we all have bills to pay, um, people leave and try and go and get other jobs. And by virtue of people leaving, you may find yourself in administration as a supervisor because everybody has gone for that higher paying job elsewhere. And so many times, social work students, how many want to be in administration? How many want to, sort of run the show? And like, there's maybe 2 people that raise their hand. And my message is get ready because you will most likely end up being a supervisor at some point. And it's really not bad. Your clients just change. It becomes the staff instead of the people that you were working with. But this is an example of other kinds of jobs that you could have in aging. You could become that program manager or program coordinator, working in all kinds of, arenas. So, even like, what Fay is talking about, who's in Martha Stewart's, certainly there's like these divisions where there are program managers and program coordinators thinking about the medical and the health services. So this is, again, social services. Here's JASA, the health services, SPA, neighborhood shop is another good example of social services. You all probably know these because your colleagues are interning in them, right? So this is where you get really good experience. But there is also the need for the program managers in these areas, right? Then talking about this is the next one, thinking about social work director. I was thinking more institutional for this one. Assisted livings and the assisted living programs. Assisted living is for individuals, older adults who need a certain level of care. They could feed themselves, but maybe they need help reminders for medication. They may need some assistance bathing, somewhat dressing, but limited. The assisted living program, what that is, that accepts Medicaid dollars. So in assisted living programs, there could be maybe, we'll just, in assisted living buildings, say there might be 5 beds that accepts Medicaid payments. So they basically are serving the same kind of people. The skilled nursing facilities, you always need social worker directors there. And thinking about the residential homes, I mean, this certainly could be for the developmentally disabled individuals as well. Then, of course, you could go into being the executive director, president, or CEO. And I have to tell you, I mean, yes, you will apply for them, but you would be surprised. You might find yourself there without even realizing that you'll turn around and you'll look and you'll say, look at where I am. Because what I wanted to say also, it's about following the breadcrumbs. When I started working, again, you need a job. So you know what? Here's an area where I think I would enjoy working. You work there, next thing you know, oh, there's another job opportunity here and another there. And it's following these little breadcrumbs, and especially if it feeds your career aspirations. Certainly also, you could go into academia. You could be an instructor, whether you are an adjunct like myself or full-time professor like Dr. Heyman, everything in between, right? Also to be the researcher, I have to tell you, there is an increasing need for research, and especially around older adults. There's nothing that's out there, or I should say very little, not nothing, very little about the needs of older adults. And as well as being the author, have you seen so many of the people? I have to kind of laugh because it's almost not that it's becoming popular reading or popular writing, but there's a lot more, I'm going to say non-research based books that are being published that are about older adults. What is it like to either be an older adult, to live with an older adult, to care for an older adult? You know, so you have that opportunity as well. And it's all based from your own information. Well, in terms of being the lobbyist and the advocate, that's something I really have always enjoyed, because that to me is really about getting the legislation to be responsive to the needs of whoever your population is. And you as social workers, what I would suggest, whether you actually go on and be a lobbyist or not, there is no doubt that you're going to be in a situation where you know that, say, city council needs to pass a law, or I don't know if this is a law, we won't say this is a law, but you know what? You need to have a light on this particular corner because there's a lot of older people that are here and nobody's paying attention to it. Well, you need to know who is the legislator, who is the council member in that area, that you and maybe best bring some of these older people that live in that area. Go have a visit with this legislator and discuss what the situation is and why you need to have that light. That's advocacy and lobbying at its easiest, at its like lowest denominator, so to speak, right? So, and we are talking about human rights. Actually, with the, you know, it is about having your 2-minute elevator speech ready for people, right? You never know when you might run into that legislator at the grocery store. Oh, by the way, so the community organizer and the trainer, one of the things I wanted to say about all these are not mutually exclusive activities. I have been a case manager, I have been a program manager, but I've also been an organizer and a trainer, going out to the community to talk about, when I'm thinking when I was doing elder abuse work, going out and talking about elder abuse to the institutions that need police, you know, patrol divisions, to let them know about persons with Alzheimer's disease, how to approach someone who has a dementia. One job is not, it doesn't have to be a myopic sort of approach to your work, is what I'm saying, you know, because there's all kinds of opportunities, including being your own business person, your own entrepreneur. There was a social worker I knew who wanted to go into somebody's home. She was an OT. And she developed her own business to go into people's homes to bring activities to persons with dementia. So, okay, so here are some of the settings. How am I doing on time, Jen?
Oh, good.
Yeah, okay.
Very good. Yeah, you could just, summarize this because this is interesting as well.
Yeah, well, here's the thing that I really want to, let me see, because I actually had made some notes on this. So thinking about in the older adult center, so these are again, these are not, this is not everything. I'm sure there are other opportunities here, but we're talking about the different agencies, the hospitals, the housing. In older adult centers, you know, one of the things that I was thinking of, there's opportunity for teaching English as a second language, citizenship training. There's all kinds of different things that are available out there. Managed care and the corporate world, interestingly, actually even thinking Emblem, there is a need for social work because again, social workers have the skills that people that are in business don't have. It's the insight that you bring, the perception, and that can be enough to just sort of shift the direction that an agency might go in. This integrated care management and managed care, well, Fay could do a whole other session just on that, right, Fay? Because that is the world in which we live now in terms of healthcare, and that's enormous. Legal services, retirement, government, thinking about working in the, in local, state, and federal government. When you think about planning, I started making like a laundry list. You could be planning for areas in your town for recreation for the aging population that has no place to go. You think about playgrounds. They're around the world. Some of the stuff through the UN I'm learning globally, there are some countries, some areas in certain countries that have playgrounds that are intergenerational playgrounds. There's an area for young people and an area for older people, and it's an opportunity for that melding that everybody seems desperate to be, really targeting these days, right? But there's also issues around climate, all of the climate mitigation that has to happen now. And when you think about so many areas of our country, even in our country, that are flood prone now, well, a lot of times people that are living right by the areas that are really getting the floods, these are often the people who are older and impoverished. And so there needs to be somebody with an eye towards humanity, towards human beings, who's on that planning board. Also, what about even planning for community responses to disasters as well as hurricanes, like thinking hurricanes, climate issues. There's so many areas that are available to us with our, what? It's our minds that limit us. Social work, if there is ever a profession that is applicable, again, I know I'm repeating this, but across boards, it's social work, just because of the perspectives that we have. So then thinking about like the United Nations and, think tanks, boy, oh boy, do we need think tanks that have compassionate eyes in them. So thinking about, the Brookings Institute, for instance, Cato, it was the Cato Institute. There are lots and lots of places. Thinking about colleges and universities, just to sort of wrap that up, there's older people are returning to school at later years and graduating and so proud because they've always wanted to go to school, but they had to do other stuff, right? And continuing education. There is so much that is available, so much that is available to us as social workers. And I guess maybe I'll stop sharing on that one. Yeah, so I guess we'll stop on that, Jenna.
Thank you.
Yeah.
I'll wait till you pull that down. And then first I want to thank Lily and Elizabeth for introducing these amazing speakers, because I think Fay and Robin have really brought to life, working with older adults and their families through many different levels and many different settings. So I'd like to open it up for questions from students to hear a little bit more about what are some of the things that you would like to know about working in the field of aging. Does anybody want to start?
I have a question. How would I apply? I'm graduating. I'm walking in May, but I'm graduating in August. But both of my generalists and my specialists is not dealing with people who are like in the aging population. How do I apply, or how do I get my foot in the door as a new graduate?
Okay, Robin, do you want to start, and then Fay can maybe add as well?
Yeah, I'm really just going to echo what Jana had said at the very beginning, is that you might not go to work specifically with older adults, but there will be older adults in that family system somewhere or another. So by you being willing to understand about older adults, you're ahead of the game. So you could find your job, and you will, and the older people will find you.
Okay. All right. Thank you.
Yes,
Fay,
yeah,
did
I
you want to add to that?
Yes, I want to kind of echo what you just said, because, even if you work, say, in the, adolescent health center, you are going to possibly be dealing with, grandparents. So yeah, I think any area that you seek and you get your foot in the door is really a start. In order to get jobs at Mount Sinai, the best thing would be to go to their human resources website to see what jobs are available. And, Dr. Hyman, I'm very happy with, with you sharing my number with the students. If anybody would like to call me, feel free to do so. Yeah, for you to
Okay,
apply
thank
for.
you. You said is in
Mount Sinai, the
Manhattan?
Human Resource Division, I believe, is where they post the positions.
Okay.
Mountssinai spelled out, yeah.
Thank you, Faye. I know Nat, do you have a question as well?
Yes, thank you, Professor Heyman. I have a question regarding, okay, first of all, I'm a first year MSW student, and I currently work as a business manager at an assisted living facility. So I overlap a lot with case management. And in just the beginning of my studies, I want to really gain as much knowledge and mentorship as I can in terms of going into the aging route. Faye, you mentioned that early on in your talk, you spoke about a fellowship, that there's some sort of stipend or some program where students are able to work with you. What can you speak a little bit more about that? Because I would
Yeah.
love to know more about
Sure. So it's not directly working with me. There is the Upper Interagency Council on Aging, which combines the Upper Manhattan and West Side and East Side. And we've been, I mean, I haven't been a part of the agency from the beginning. I joined a couple of years ago, but for many years ago, they had grants where they provided students who were interested in the field a grant. Now we've expanded it a little bit. We had gotten a little bit more money, and we work with a few schools now, which is nice, but we've always worked with Fordham, so Fordham is our favorite. But you know, we do put out the request. I'm gonna Heyman, when is it? Usually in the summertime? Well,
Yes.
yeah, we put out the request for those students who are interested. You're required to, I guess, send your resume and a brief, you know, a write-up about your interest in the field and what your, you know, field placements are. And, you know, if you're chosen, then you get the stipend. It's up to $1,500 now. And the only thing that we really request is if you can attend some of the meeting, that's fine, but we understand that you're in school and it may not be possible. But something that we instituted about 2-3 years ago was we asked that you just do a little presentation, you know, like 10 minutes about the, you know, field placement that you have and your interest in the field. And then at the end of the year, we just honor you as part of our, you know, interagency council. So I'm hoping you will apply.
And it's also geographic, correct? Because is it in the New York City area, right, Faye?
Um, yes, but I'm not sure that we would, you know, say no if we, you
Okay.
know, we didn't, you know, if that wasn't possible. No,
Thank you. I
I
have a
think we'd be
follow-up
okay.
question.
Yeah, sure.
So I know you mentioned field placement. So I just interviewed for my generalist field placement, and I'm going to be working with the NYC Public School Collective. And I did have the option of pursuing DeRote, which to me it was very exciting to think I could continue working with seniors, even though I currently do. And I was just thinking of diversifying my portfolio in terms of thinking of like palliative care down the road, like understanding that palliative care doesn't just affect the aging population, but it also affects, it goes, you know, it's basically across the lifespan. So that was my thought process in selecting my field placement. But you mentioned field placement. So is that something additional, or is that like where does that fall?
So I'm not sure that I'm understanding your question completely. I mean, you know, we do work with a few schools, and you know, we then place students here in different areas of the hospital.
Okay, okay.
You know, so it, you know, it depends also about on the availability of field instructors. So, you know, even though we have a palliative care division, we may not have, you know, a field instructor who's social worker who's interested in being a field instructor.
Oh.
So I couldn't really guarantee, you know, what your field placement here would be. But certainly if you are interested, you know, the person who coordinates the program could probably speak to you and tell you what would be available.
Thank you so much.
And Natalia, but you can also email me directly about, you know, your interest at what as well. Heyman, Heyman at Fordham.edu. I always advertise, I have the best email address.
It is
Heyman.
very cool.
And I think Tanya had a question. Tanya, are you still here?
I am here. Hi. Yeah, quick question. My name is Tanya. I have been a caregiver for about 13, 14 years now. I am a student at Fordham, graduating in May. My current placement is with hospice in the bereavement department, and I did a previous internship with family services as an elder abuse case manager. Um, this may or may not be a dumb question, but how likely is it as a freshly graduated student to um, apply for a job in the field and get hired versus someone that has a lot of experience?
So, you can always try. I mean, yes, does a hospital give preference to, say, somebody who's within the hospital system or a student who is graduating from here who already knows the system? But that doesn't mean that we don't hire people from the outside. So
Okay.
keep looking at the, postings. And like I said, I believe it's listed on the, HR website for Mount Sinai. Keep looking at the postings and if anything, seems appropriate, then apply. And then, follow through.
Okay, thank you.
Sure.
Thank you,
Let me
Tanya.
just add, that's a fair question. But sometimes you just hit the right interviewer or the right person who is hiring, and they are willing to take a chance on a new hire, someone right out of school. Because you know what? Because it gives them the opportunity to shape the person
Mhm.
in the way that they would like their team to be, so to speak, so that you're not coming in necessarily with preconceived, this is how I have to do this, but you've had the experience in a couple of different areas. And all of this just adds to your worth as you go through your career steps.
Yeah, and I just want to add that you never know what piece of your experience will be so helpful. Like you're telling me you're the elder abuse, you had elder abuse experience. That means you saw a lot of tough cases, so the hospital might be very, or wherever you apply might be very, impressed by the fact that you probably dealt with a lot of hard cases, difficult cases.
Right.
Thank you.
Thank you.
And Laura, you had a question as well.
Hi, my name's Laura. I am in the specialist phase of the program. I'm just wondering, I'd like to either go into hospital social work or palliative or hospice care. I'm in northwestern New Jersey. Karen Ann Quinlan is the big hospice up here, and they have an end-of-life doula program. And I thought, trying to get in my social worker mindset with the code of ethics, that might be a dual role, and that might be against our ethics. But then someone also mentioned that it's a specialty. And so this is where I'm interested. I'm also entering the field later in life. I'm going to be 57 this summer. So I want to make myself somewhat marketable too, especially since I'm in a rural area. And I'm just like, a doula, is that something to pursue on top of the social work? Is that marketable? Is that against our ethics if we're in dual roles? And how do we know when we're taking on more training if it's going against
Laura, are
our
you
ethics?
are you in your generalist year?
No, I'm in my
You're
specialist.
in you started or you're finishing?
They haven't been able to find me an internship yet.
Oh, I see. Okay, so
Yeah, I'll graduate. I should complete the program in December.
oh, in December. Okay.
Yeah.
Well, I could always talk to you more about that. Faye and Robin, did you want to add anything?
I personally,
Okay, go ahead. I'm sorry.
no, Faye, take it
No,
away.
because I wasn't sure I understood what you're asking. Excuse my ignorance, but I didn't catch the beginning. I think
Like, there's a doula program for an end-of-life doula. And
doula.
doing that program, is that like against, in violation of our ethics, having a dual relationship, dual role? Or is something like that a specialty where it makes us more marketable in the field?
Well, I think also the timing and when you're planning all of this, because I mean, it sounds also that you still have to finish your specialist year field
Yeah.
placement. Yeah, so, you know, I could talk to you more about that as well. Robin, did you have anything you wanted to add?
Yeah, I mean, you know, to me, you're approaching this with the perspective of service. And what you are learning in your palliative care internship or when you get it, and the academics that you have and the doula training, to me, and I would be willing to be corrected if anybody, has experience, to me, you would know when, yeah, to me, they almost could be complementary skills. And you would know when you need to go this way or when you need to go that way with this person or that person. And that might be something that comes through experience. But this is also, you say you're in a rural area. I don't know if there's supervisors around. I mean, that's one thing, that if there is a supervisor that, that you would be able to work with if you came to a situation that you really weren't sure. I think, you know what, that's one thing else that I would say for everybody. Any kind of decisions that you are going to make, if you feel like you're out on a limb, you best have your supervisor on that limb with you. You don't want to be on a limb by yourself, and especially when you have, there's so many, it's such a litigious world we're living in, and while you are doing you're performing your work with good intentions, still in all, best to have supervisory and documented supervisory, meetings for some of this stuff. Yeah, because you don't want to lose your career.
Yes.
Yeah.
And you know what's really important is you're still in your studies right now. So I think, really focusing on your social work degree, if you're finishing up your specialist year, is very important as you move forward. And I think what Robin was explaining, the importance of supervision and understanding ethical issues and dilemmas and so forth, will continue to, not only during your MSW degree, but whatever you pursue afterwards, is critical. Because I think every time we, graduate, people say, oh, I'm going to, be a social worker. Yes, but hopefully you will still have supervisors. You will have people that are much more knowledgeable than you are, and they will be giving you the wisdom, their knowledge, experience, but also the evidence of the work for you to get involved in doing, in whatever path you so choose. Are there, Jessica, did you have any other questions?
I do. I want to say thank you so much for this. It's been educational and I've enjoyed it very much. So thank you. I do have a question about licensure. So for example, Faye, you have 4 people handling a 3,000, person facility. Are you seeing that you're only hiring LCSWs, licensed? I mean, that's what I'm seeing a lot in when I scour kind of Indeed, et cetera. The licensure is really important.
Yeah, so, Mount Sinai is pretty strict about this, but they will hire you without the license, but you must pass and get the LMSW within a year of hire. If you do not have that, you're out the door. I hate to
Okay.
say it that way, you're out the door, but they will hire you with that temporary thing. I think there's something a temporary till you can get the LM, I believe. But you do need to get the LM within the year.
Okay.
And then, you work towards the LC. I mean, the one thing that I had forgotten to mention before about Mount Sinai, which I'm glad I have the opportunity now, is that, being that it's a teaching hospital, for the medical students and for the doctors, there's a lot of opportunities available for social work as well. So we have like grand rounds where we have lectures, either through people who are working in the department or outside speakers. We have continuing ed course, and we don't have that many continuing ed courses now, but we used to. But we do have, lectures. We have continuing ed credits, CEUs that we get. Whenever we have grand rounds, we can get the CEUs. So we have wonderful, wonderful opportunities here. But you know, the one thing that they are strict about is the licensure. But they do give you the opportunity to get it.
Thank you. And I had one more question about following the breadcrumbs. Supervision seems, you know, it's critical and it's required, really, I believe. When interviewing, how important is it to meet our supervisor on site? And how much weight do I put on that when, you know, made an offer? If I were to receive an offer from an agency, or do I get outside supervision? Do I pay for that separately? Not really.
Yeah, those are important questions to ask. Definitely here we do provide supervision. But honestly, I'm not so familiar with the hiring process here, so I don't know whether you actually meet with the supervisor initially. You definitely meet with the director of the department and the, you know, other people who are involved, in that social work area, because we have so many different, we have maternal health, we have, you know, adolescent health, we have child and maternal health care, we have med surge, we have the cancer center. There are so many different divisions here. So I don't know whether at the very beginning you meet with your direct supervisor. I would assume so, but I don't want to say for sure, for sure.
Thank you.
So let me just add with the social service agencies, because they are a much smaller entity, it's very likely that you will be interviewed by the supervisor. Maybe there might be your supervisor above, so maybe there's a task, if you will, the task supervisor, but then the supervisor. Maybe with the task person you might interview first, and then if you pass that one, the supervisor often will want to speak with you as well. But most times in like the regular social service agencies, it's so small, it'll be your supervisor most often who would interview you first off. And you can tell, I mean, you know, when you meet people, you can feel, is it going to work? Is it not going to work? You know, but you also feel, you need to feel empowered to ask the questions. You know, if you're really about, because honestly, it's like, oftentimes people are just, we are so desperate to get people in. We're not
Right.
going to say anything about supervision right away because it's not top of our mind. But if it's top of your mind, ask it. That's, you know, because you're interviewing them as much as they interview you, you know, because you're going to be spending a whole lot of hours with these people. So you want to make sure it's a place where you will be comfortable for some period of time.
That was my next question, right? Is it okay to ask, you know, what does supervision look like? And will I have, you know, one-on-one supervision on cases, right? I think
Yeah.
that's going to be really important, especially as a new social worker.
Mm-hmm,
Great, thank you.
Yeah. No, that's real important, and that's a very fair question. And if you have issues with that, I won't work there. I wouldn't work.
Thank you.
If they have issues with you, I wouldn't. I don't think I would work there.
Thank you.
You know, and I want to just add also, like I said before, you know, we're very into education here. So we want you to, you know, have the supervision. We, you know, encourage you to present at, you know, conferences. And we encourage you, once you get that LMS, you know, and you need, I think, 3 years of supervision for the LC, we encourage that. They want you to apply for these things.
And I just want to mention that, you know, for those students that are graduating, you really do recommend looking at this LMSW as an exciting opportunity to take the exam. And one of the things that we recommend, Fordham does offer a lot of resources to you as you're graduating. And remember, it's under the ASWB board. And usually before you take the exam, a couple of weeks before, you can also purchase the ASWB practice tests, and it's $85 approximately. Those practice tests are very valuable. You know, I always say, if you have $85, I should check the price because I never know this year, but it's a good practice. And sometimes some of those questions show up on the exam, believe it or not. I had one student say, there was on my practice test, the exam had like 7 questions from my practice test. And, you know, and they said it just helped them really do that. But you have to wait till you graduate. You have to fill out the correct forms. If you fill out the correct forms for your exam after you graduate. Remember, you need to show your degree. You can really start studying, and this is a researcher in me. I know I have my aging background, but my research says take your exam within 6 months, you're more likely to pass it. So that's the research data on LMSW exam taking. So just throwing that out there. Are there any other questions on aging though? For our panel? Well, can we give them a big, oh, Robin, did I see one?
You know what? So the UN worker in me has now come out. Recognizing that if we are all lucky enough, well, I'm already kind of in that part, but if you're all lucky enough that you will also one day be an older person. And so this is something that covers, colors how you can approach your work, because you want to have things in place. That's actually why I started working in the Department for the Aging. I want things in place for when I got old, so just kidding. But the WHO, World Health Organization, had done a study, and fully 50% of the globe has acknowledged ageist or stereotype or prejudicial behaviors. And we encounter it all of the time. And so that is part of our work as well. We want to be old. So you know what? It's important to have that understanding and the respect that youth are age in the making. Older age in the making.
I love that, Robin. Thank you.
Yeah.
I do agree with you wholeheartedly. And I'm just so glad you came to the session, everyone. And let's give a round of applause for Fay and Robin. Thank you very much.
Thank you.
Have a lovely evening, everyone. And if you have any questions, hey man at Fordham, I don't guarantee all the answers, but you can always reach out. Okay? Thank you again.